Hi everyone, good evening. My name is Tanya Winders and I'm the President and CEO of Allergy and Asthma Network, and it is my pleasure to welcome you to this evening's Facebook Live. I'm very excited to be joined by Dr. Joanna Zeiger and Dr. Robert Zeiger as we have a panel discussion and a demonstration of effective breathing techniques for those living with asthma, allergies, COPD, and other respiratory conditions, including exercise-induced bronchospasm. If you've not ever questioned if you're breathing correctly, then certainly, or no one's ever taught you how to breathe correctly, then that's the point of tonight's exercise. So we're going to start out with a few basic questions for Dr. Bob and Dr. Joanna and get their insights around why it's so important to breathe appropriately and correctly. And then Joanna is actually going to lead us through a demonstration of how to do so. So as we get started, Dr. Bob, please share with us why it is so critically important for those living with chronic respiratory conditions to learn proper breathing technique.
Thank you, Tanya. This is a very important session that you have, that you're leading. Unfortunately, breathing difficulties are very common, not just in those with asthma and allergies, but also the general population. If they looked at collegiate athletes who are exercising, 50% have some breathing problems, aside from whether they have asthma, they just have breathing problems. If you take a look at adolescents who are just starting out exercising, they'll find 35% of them having difficulty breathing during exercise. If you take an unselected population, almost 10% will have breathing difficulties with exercise. Why is it so common? I think it is that no one has taught us how to breathe properly, and that with the pressures of society, the pressures that lead to release of certain hormones like epinephrine, it causes us to have sort of a fight and flight type of status. And what that does is cause us just naturally to have a faster heart rate and to breathe more quickly. And when we breathe more quickly, we become somewhat more anxious. And when that occurs, we tend to try to breathe even more frequently, which creates that particular problem. And as it turns out, there's a difference relative to gender. Females have more problems with breathing difficulties, exercise intolerances, and possibly in part has to do with at rest, women have a faster breathing rate than men. They have smaller chest sizes. Volume-wise, their diaphragms are almost 10% smaller in size. And so when they're going to exercise, they're going to have more problems maintaining a certain rate of exercise more than men will have. And women need more oxygen during exercise because the diaphragm is not working as well. And so with those phenomena occurring, it is not unexpected to have many individuals with breathing incorrectly.
That's really fascinating, Dr. Bob. You know, we get calls from people all the time who are living with asthma or COPD and who say, you know, I can't walk up a flight of stairs without becoming short of breath, or I definitely could never exercise because of my shortness of breath or my cough. So how do you help your patients in the clinic kind of determine if it's asthma, exercise-induced bronchospasm, or something else?
Well, I think it's a great question. First, I'm going to determine, just looking at them, how they're breathing. I'm going to assess whether they're having abdominal or chest breathing, and that's relatively easy to determine. And that's going to help me just identify whether there's abnormal breathing that may be the cause, and the sole cause of the problem, or as we know with patients with asthma, maybe 30% of those patients will have some of these breathing difficulties that aggravate the asthma. I'll determine the degree of control of the asthma in itself. Those patients who have more severe asthma have more difficulty exercising just alone. Even if they did have normal breathing, It's just that the asthma is not being controlled as well. There's inflammation within the lung. The airways are tightened, and it makes it more difficult to breathe. So the caveat is fine. First, identify whether a patient is breathing correctly, as Joanna will go over. Second, determine diagnostically what is the cause. Is it asthma? Do they have reversibility with a rescue medicine like albuterol? Do they not have that? Do they have a problem when they exercise? They say, no medicine helps me at all. That's typically not going to be asthma. Patients with asthma, when they take medicines, when they're exercising, their asthma will improve, their exercise intolerance will get better, unless they are having problems with breathing. They could have exercise-induced laryngeal obstruction while they're breathing. They have a paradoxical or abnormal closure of the vocal cords during breathing, which will lead to a panic attack-like symptoms, raspy breathing, a feeling of suffocation. They feel lumps in their throat, which are different than asthma. Asthma is typically an illness where there's difficulty exhalation, breathing out, while in these other forms of breathing difficulties, usually the problem is in breathing in. They have problems, they can't get their air. I just can't breathe. And when a doctor hears that, it lights up that the patient is probably not having asthma causing those symptoms.
Yes.
But to be aware that
Right.
patients who have asthma, over 30 to 40% have abnormal breathing,
Wow.
separate from the asthma.
Wow. I didn't realize it was that high. And,
Yes.
but it's so helpful because we hear patients all the time who say, I can't get a breath, I can't inhale. And then those that are having trouble actually exhaling. So the difference is very helpful to help patients distinguish between the two different types of conditions.
The only time an asthmatic, really, patient with asthma, has real problems in getting air into their lungs due to asthma, they are having a severe asthma episode. Could be life-threatening, but that is not the typical situation for patients who say, I can't get air in. It's because their vocal cords have abnormally come together and they can't get air within their lungs.
Right, and they feel it here in their throat.
That's right, the throat. Right, something's stuck in their throat.
Right.
They're suffocating.
So is there like a validated questionnaire or some type of tool to help us know if we're breathing correctly?
There is, and I think Joanna has that tool that maybe she could put on the screen. It's a tool called the Nijmegen questionnaire. It's a validated questionnaire, multiple questions that if you have a certain score, above a certain score, you have a high likelihood of hyperventilation or breathing too.
And we put the link in the promotional materials, and we'll put the link back in so that people can take that and score themselves, and it actually shows you on the top what the score is that means that you have hyperventilation or breathing dysfunction.
That's really great.
Very helpful.
Yeah, really great. Super helpful. And I think that, again, most of us just take our breath for granted, right? No one ever taught us how to breathe properly. We just came out of the womb and started breathing, and that's, how we have progressed from that point forward. So, Dr. Joanna, tell us kind of when you realized the importance of proper breathing technique.
Well, I think that there should be, this differentiation between dysfunctional breathing, which is sort of a mechanical issue that people have with their breathing pattern, that they aren't breathing in the correct manner, using their diaphragm, expanding their rib cage. They often lift their shoulders, so it's a mechanical issue. Whereas things like asthma and COPD, those are medical issues. So it's important to differentiate between those two things. And as Dr. Bob said, that a lot of times it's very easy to pick up just by looking at somebody's breathing pattern when you see them lifting their chest. And a lot of times I can even hear it when I speak to somebody on the telephone. I can hear them taking that kind of rescue breath because they're short of breath. even just speaking. So I am an Olympian in the sport of triathlon, 2000 Olympics, and I also have asthma. Sort of started mostly as exercise induced, but now over the years, it's sort of morphed into just more general type asthma.
Okay.
I had a terrible bike accident more than 10 years ago, and I did severe damage to my rib cage, and I have nerve damage to my intercostal nerves, and the intercostal nerves are important for breathing and to aid in diaphragmatic function. And because I have so much damage there, and I've got asthma, I've got a lot of strikes against me with being able to breathe normally. And so I was feeling short of breath all the time. And doctors kept telling me, well, you should be healed, and, you know, broken ribs don't take that long. But I realized, you know, I have some severe chest wall issues, and it's very important for me to learn how to engage my diaphragm, because if I breathe too much through my chest, I end up with a condition called costochondritis, which is when the joints where the ribs attached to the sternum get inflamed. And it's a very painful condition. And a lot of chest breathers end up with pain there, and they don't even recognize it because they're so used to having that discomfort. And when I work with athletes and I ask them to kind of press along here, or, you know, along these ribs up here, or touch their xiphoid or the top of their diaphragm or along their abdominals, they realize, wow, that's really tight. That really hurts. It doesn't move. And so particularly with people with asthma, and it's not well controlled, and they start to hyperventilate, they create bad habits with their breathing.
Right.
And as Dr. Bob said, in the general population, you see it too. So it comes from just bad habits because nobody taught us. It comes from postural issues, from sitting a lot and hunching our shoulders and getting into position that doesn't allow for the diaphragm to expand. So there are a lot of reasons why people end up with dysfunctional breathing.
Right. Yeah. And again, I mean, most of the time, none of us have actually ever been even taught or shown how to properly breathe. So that's why I think that this is such an important topic for those living with chronic respiratory conditions. So, I know that we've got certain reasons why we're doing this for our community and population, but tell me, do you do this often? Do you teach like athletes and those living with respiratory conditions how to do this frequently?
I do. I work a lot with athletes, primarily with athletes, many with vocal cord dysfunction, many with asthma, many who just have improper breathing technique but don't have an underlying medical condition. I've worked with hundreds of athletes, and the only one who had proper breathing technique was a dancer.
Really?
Previously been a singer. And so she knew how to engage her diaphragm. But I've worked with world champion triathletes who had uncontrolled, terrible, terrible dysfunctional breathing because of it. So there's nobody that is immune from having dysfunctional breathing. It just creeps up on you.
And
all benefit from this tonight, right?
Excuse me?
So we can certainly all benefit from this today, this evening.
We can all benefit from it. And I think, people don't understand the function of the diaphragm, and that it's the primary breathing muscle, and that the chest and the shoulders are not where you're supposed to initiate your breaths.
Yes.
just imagine,
Yeah.
just imagine that at rest, your breathing rate is faster than it should be because of anxiety, because of too much stress. If you're breathing more quickly and then you start exercising, you're starting at a level above which you should be. And therefore, when you exercise well to begin with, then you're going to feel stressed. I can't get air in. And what happens to a lot of your athletes you see, Joanna, when you ask them certain questions, when they're breathing with some difficulty?
Yes, this is one of the things I always ask people, particularly those with vocal cord dysfunction. When you have trouble breathing, do you slow down or speed up? And the normal thing you would think would be that, well, I slow down so I can catch my breath. But inevitably, they always say, I speed up.
Yes.
And so it's very interesting that a lot of athletes want to outrun or out-exercise their condition. And believe me, I have fallen prey to that myself. And I want to let you know that you cannot outrun your asthma. You cannot out-exercise your asthma or your vocal cord dysfunction or your breathing dysfunction. So it's very important to have if you have underlying disease, to make sure that that's well controlled with your doctor, and then working on the mechanics of the breathing itself, so that even when you have controlled disease, that you can still take that breath in, and that you don't have that feeling of, oh, gee, I can't breathe, I'm short of breath, I've got to stop.
Right. Well, Dr. Bob, you mentioned about just the anxiety and the stress, and I think we're all feeling that at this particular time in the period of the COVID-19 pandemic. I think we're all living with a heightened level of stress and certain fears or worries or anxieties. And so, again, I think that learning these proper breathing techniques can help us all to hopefully de-stress and, process and go about our daily lives with a bit more inner peace and certainly better breath.
No question. And determining, as Joanna will go over, determining if you are breathing correctly and what to do if you're not.
Yeah, absolutely. All right, Joanna, so are you ready to help us learn how to breathe better?
I will certainly do my best. So in order to be able to breathe, in order to go through these exercises, I recommend having a few basic tools. One is a mirror, so that you can watch yourself breathe. So you can get yourself a nice mirror like this almost anywhere. Or, if you're just starting out, you can stand in front of your bathroom mirror and watch yourself breathe. So I'm just going to move this out of the way. But you want to watch yourself. And that's very important, because if you don't watch what you're doing, you're not going to be able to break the habit that you have. Mm-hmm. So the manner in which most people breathe is they stand, with sort of, a lot of people have kind of a specific posture that's very common, from sitting at our computers and driving, and that's sort of with the shoulders kind of hunched forward a little bit, with the arms in front, and most chest breathers have one shoulder that's higher than the other. Mm-hmm. And back, what you see a lot of times is their butt is really far behind them. So you get sort of this position of, you're not really fully standing tall. And so, everybody's got a little arch in the back, but a lot of people have that arch is exacerbated, so that they're really arched in the back, the butt's back, shoulders are forward. So you can see in this position, I've basically cut my diaphragm off and cut off my rib cage. So the only thing that I can do now to breathe is this. So this is the breathing pattern that I see from most people. So again, that's with an arched back with the butt behind you, very rounded shoulders, one shoulder higher than the other, hands in front, and then all of a sudden now you're breathing like this. And there's a very typical sound to that. So when I said that I can hear on the phone when people are breathing, you get this just really loud sort of hyperventilation sound that people typically have with this kind of breathing pattern. So the postural component that goes along with this. So for people that have underlying medical condition, and they also have some postural issues, they really can get themselves in trouble with hyperventilation and breathing dysfunction. So the better posture that we're looking for is to have the shoulders back, arms at the side. You want to have less of an arch in your back. And now you can see all of this is very open. And now I'm going to just lift up my shirt here so you can see my diaphragm moving. And from the front,
yes,
I'm not lifting my shoulders. And I'm not breathing through my chest. Versus, and the thing that people can do is put their hand on their stomach and on their back, because when you take a nice deep breath through your diaphragm, you should also feel it back here. The diaphragm is a huge muscle, and I'll send a video that you can link up to this, that you can send out to people, that shows the action of the diaphragm. But the diaphragm moves in 3 dimensions. You want it to move this way, move this way, and it needs to move up and down. And so when you're like this and you're locked, and all you're doing is this, most people are only getting their diaphragm to move up and down this way, but they're not getting it to move out this way or this way. And good diaphragmatic breathing also will help people with low back pain, because when you do this correctly and you breathe into, you breathe into your hand and you feel it in your back, that's offering some protection from your back from that arch that is going to help with some low back pain that people get. And particularly for people who exercise and who need to engage their glutes, when your back is really arched, you can't engage your glutes. But when you breathe through your diaphragm, all of a sudden you can turn your glutes on and it will prevent a lot of injury. So how do you go about getting proficient breathing through your diaphragm? One of them is awareness, looking in the mirror and watching your current breathing technique. The other is, starting with your hand here. But this is actually the hardest position to breathe in. So one of the things that I have people do is they'll lie on their back, and they're going to put their feet on the ground, and they're going to have their knees up. And when you lie on your back, you want your back flat on the mat. So you don't want to be able to put your hand underneath. Okay, so the back should be flat. See, hand can't get underneath. And then you can put a weight or a book or something on your stomach. I'm just going to use my phone because it's right here. And you're just going to breathe. You put your arms down at your side like this and relax, and keep your neck relaxed. And you want to put something on your stomach that you can watch rise and fall. See that?
Yes, yeah.
So the other thing that you can do as well, if people have something like a foam roller, this is a foam roller that you can use. Something of this height, maybe about 6 inches. And you want to put this underneath your feet. Okay? And then what you're going to do is you're going to lie back down in this position that I was in, and you're going to lift yourself up off the ground. And you're going to squeeze your glutes as hard as you can. And what you're doing here is you're going into full hip extension. All right? So remember when I talked about earlier on that people have this arched back, and that prevents a lot of proper breathing? Well, this takes the arch out of your back. So you want to make sure that your back is nice and flat. So you don't want to extend so much that your back is arched. You want to extend just enough, squeeze the glutes, okay? And then you're going to take some deep breaths. Do you see how big my belly is getting?
Yeah.
So when I put people in that position for the first time, they get that deep breath. 100% of times, there is just wonderment, because they're like, I have never taken a breath that big. And so what I've done is I've taken out that arch and allowed people to really get that diaphragm engaged. And this is the deepest breath you can take. It starts really low and it goes really high. And it's for people who have had struggles with breathing and have never really engaged their diaphragm. In this position, they can do that, even if they've never been able to do it before. And it is like a revelation for them. And so this position is great so that you can get the muscle memory and learn inside your head what it feels like to be able to take a nice deep breath. Now, part of the problem that happens is that because people have been breathing incorrectly for so long, and they sit with their shoulders like this, their diaphragm gets really tight. If you ask them to touch along their rib cage, they're very sore. They're very sore in their abdominals. Your rib cage should move. See how my rib cage is moving out from side to side?
Yes.
Well, people can't do that because it's basically stuck. So there's a technique that you can do to help open all that up. This is just a very small yoga ball. And so people can use this to start opening up through the diaphragm and the rib cage and all these muscles in the abdominal, everything that's gotten tight from lack of use and poor posture and just the daily living. And so what you do is you just kind of start low and you find a tight spot. And you're like, oh, gee, that's really tight. I'm really tight there. You just kind of hold it and breathe into it. And then you see I just dropped a little bit. So I got there myself and up. And then you just kind of move up a little bit, and you move up and you move up until you get to the very bottom here at the apex of your sternum. And that's where most people are going to be the most sore because there are so many attachments to the xiphoid process, which is a little piece of cartilage at the bottom of your sternum. And you really just kind of want to work that. You don't want to kill yourself, work into it. But that's going to help open up so that you can get that diaphragm engaged. And then the other thing to help with the movement of the rib cage is having like a yoga strap or some kind of physio band. And what you do is you just wrap that around like this.
Oh, yeah, I see.
So you see that slide, and that gives you the feedback up through the rib cage to make room for the diaphragm to move.
Right, that you're doing it correctly. Yeah.
Does that make sense?
Yeah, absolutely. I mean, I'm here and I know.
Do I need to clarify anything? Do you have any questions?
No, I don't have any questions, but I was just going to say what I've realized here just in the last few minutes is that I don't breathe correctly. And that definitely I am in great need of all of the exercises that you've shown this evening. So
yeah, so one of the things I like to say is that your diaphragm is power. I call it diaphragmatic power. Mm-hmm. And when you do this really well, your belly should get nice and big. And I think one of the issues that occurs, especially among females, is that they're always trying to hold in their stomach. And, they don't want to be seen as having a big belly.
Right.
To have proper breathing technique, when you inhale, your belly should get nice and big. And then when you exhale, that all comes in. And so it does not forget about everything that you feel or think or what your belly should look like. It's diaphragmatic power. Think about your breathing through your diaphragm as powering you through life, and watch yourself do it. You'll feel better. You'll get more oxygen. You'll feel calmer, particularly if you're in a high stress situation. If you can just sit and close your eyes and put your hands on your stomach and take these deep diaphragmatic breaths, you'll feel so much better, because what most people end up doing in that situation is they do the opposite. They start breathing through their chest, and then they can't breathe even more. So then they chest breathe harder, and it gets into a vicious cycle. And then you create bad habits, and we want to undo those habits.
Right, well, and it sounds like that this is a muscle just like any other muscle, that we certainly need to exercise and continue to train to properly use that muscle most effectively.
Tanya, what I want to emphasize,
like any other, and they've done studies in weightlifters, and weightlifters have to use their breath to be able to, and we're talking about like Olympic weightlifters, yes, lifting so much weight you can't even imagine, and their diaphragms are actually thicker and bigger than the general population because they are working their diaphragm so hard. So it is possible to improve your diaphragmatic strength. And the best way to stretch the diaphragm and strengthen the diaphragm is to use it properly.
That's great. Dr. Bob, you were going to say something?
Yeah, I just want to emphasize a very important point. Dysfunctional breathing in individuals may be present for decades. And then to make a change, to try to improve it, does not occur overnight. Joanna has emphasized, and it looks difficult, all the things that need to be done. But we do know that if you want to change something that's been in your system for decades, it's going to take work. But the work is worth it. It's going to help you breathe better. And if you have asthma, it's going to help you deal with the asthma much better. But it's going to take work. But it's work that doesn't take medicine. It's work that's going to make you physically feel better. And as Joanna says, it will even help you relax when you learn how to breathe better. So you're going to get lots of benefits from it.
So Dr. Baum,
For athletes, I think it also helps prevent injury.
and prevent injury, that's even better, right? So if you were talking to your patients, how many minutes per day would you encourage them to practice proper breathing?
I'll leave that to Joanna, because she's teaching the toughest of the tough to breathe properly. How long are you recommending them practicing?
You know, it's not really, I mean, it's something that you should be working on all day, every day.
Right.
You know, in terms of doing these specific exercises, that might only take, and I'll also give some links to some videos for more advanced exercises that people can do after they start these off. I've got some great videos on breathing, but it's something that you should be thinking about all day, every day. And so if you're working at a desk, you know, sitting is going to really impede your breathing. Set an alarm to stand up and practice, because if you don't think about it all the time and make it a habit, it will never take. Now, in terms of, you know, how long should you lie on the mat and do that? You know, maybe you do 5 or 10 breaths. You don't want to make yourself dizzy. So, you know, because people hyperventilate and it's going to take some time to readjust, you might get dizzy at first because you're still doing a hyperventilation type breathing. So work your way into it. But you want to get to the point where you feel very comfortable being able to take 10 or 15 breaths. And then you want to start integrating it into, you know, going for a walk. And then you want to start integrating it, if you're an athlete, into your exercise. But if it's not something that's habitual and easy to do at rest, you will not be able to do it when you exercise.
Yeah. So great advice to slowly build up over time, the length of time and the more natural it becomes, and sort of second nature, right?
It is, but it does take time. And that's why I say to people, you know, a lot of the athletes think, oh, well, I'll just work on it for 10 minutes and I'll think about it when I go do my exercise, and they don't get anywhere and they can't figure out why. And I say to them, but you don't spend much of your day exercising, but you spend a lot of your day breathing. And so that's why it's something that you all day, every day.
Right. I would typically give my patients an information sheet on proper breathing, discuss how proper breathing can be instituted. And if someone has really severe disease, I will send them to speech therapy. Speech therapists are the professionals who deal with abnormal breathing, and they make them aware of it, teach them how to breathe better, recognize abnormal breathing. However, those who still have dysfunctional breathing may have it despite the education they're getting from speech therapists, and Joanna has seen some of them, that speech therapists don't teach you how to really breathe properly while you're exercising, particularly when you're doing strenuous exercise, and that's not easy, and it's a process that one has to learn if one wants to exercise.
Yeah, so that actually,
a lot of it comes down to the postural part too, right? Learning how to get the shoulders back, opening the rib cage, opening through the diaphragm, getting the glutes engaged. And I think that's part of why people still have trouble even after going through maybe speech therapy or some other things, is that they haven't changed their posture. And so that's still impeding their ability to engage their diaphragm.
right.
Joanna, what I think is also important is try to describe what you do to help an athlete during exercise when they are having that difficulty at the time.
Yeah,
because
that's
most decompensate and start to hyperventilate, which you want to do away with.
right.
So what advice do you give them?
That is exactly the question that we just saw in our chat. So it's a patient who says, I have EIB, exercise-induced bronchospasm, and when I'm jogging uphill, are there certain exercises I can do to help me get up the hill?
Well, what I tell people when they are starting to work with changing their breathing technique, I'll give you a specific example, and I feel comfortable sharing this because this person actually spoke about his experience working with me on a podcast, so it's on public record. But I worked with a world champion, a half Ironman world champion, and his asthma was not well controlled when I met him. I could hear it over the phone. So the first thing I did was recommend that he change up his asthma medications. I guess they were making him tachycardic, so he stopped taking it. And I said to him, well, there's lots of medications on the market. There's not just this one. Talk to your doctor and get your asthma controlled. And the second thing I said to him, and this was last year, and he was in the middle of his race season. He was getting ready to go for a race. And I said to him, you've got to skip your race, because in order to get your breathing better, you're going to have to back off to get better. So what I tell my athletes is, as you're working on this, you're going to have to slow down your exercise. If you're a runner, maybe you switch to doing some run walks. You don't do intervals. And if you all of a sudden are running and you're like, gee, I'm hyperventilating, you stop immediately and you reset. You stand there, you put your hand on your stomach, you put your hand on your back, you take some deep breaths to get that feeling of what it's like, you know, maybe around the rib cage to get the rib cage moving again, and then you slowly start. And then if you get in trouble again, you stop and you reset. And so I recommend backing off activity as you're learning this. For runners, you want to do some run walk. For bikers, you just got to slow down. And you know, some of the best cyclists, and if you go on the internet and you type in, you know, Tour de France cyclists or Hawaii Ironman, you look at some of the men on the bike, their stomachs look ginormous. They are getting so much air in their diaphragm. It's like somebody pumped them up. It's like they took a pump and just pumped up their stomach. That's how much air they get in there. But it took them a long time to be able to do that. So you have to back off to get better.
That's
a person who wants help running uphill, I'd start by walking uphill and being able to breathe through your diaphragm while you walk uphill. Because if you can't walk uphill breathing correctly, you're certainly gonna have trouble running uphill breathing correctly.
right. And so when we talked about the inhale and the exhale, do you have a recommendation? Is that in through your nose, out through your mouth? How do you, as far as engage, to make sure that you're breathing properly through your nose or mouth? Because we know a lot of mouth breathers.
When I'm at rest, I breathe through my nose. When I am exercising, I have never been able to master breathing through my nose. And I know that a lot of people give the recommendation of breathing through your nose when you're exercising. I have never been able to do that. I breathe through my mouth. One thing that people can do, particularly for runners, you know, like swimming, you always hear about a breathing pattern. Well, you can also do a breathing pattern with running, where you inhale on 3 steps and exhale on 2 steps. That would be an easy run. The faster you're going, the more, you know, maybe you'll be a 2-1 or 1-1. But you can actually use your footsteps to help you control your breathing.
That's a really great tip. I've never heard that.
Now, it's very difficult to breathe through your nose when you're exercising strenuously. It's almost impossible.
Even easy exercise.
And those patients who have allergic rhinitis, in addition, have obstruction of the nose, make it totally impossible.
Yes.
You know, you have to get, if you go into exercise and you have a chronic condition, it's key to get that chronic condition controlled, whether it's your nasal symptoms, your asthma symptoms, control. If you're trying to exercise in an uncontrolled state, your exercise will fail.
That is such an important point, Dr. Bob, because it is one airway from our nose all the way to our lungs, right? And so if you have any type of impediment in that entire one airway, then certainly it could be impacting your breathing properly. Very helpful. So in our last few minutes, I want you guys to share a little bit about the project that you're working on with Allergy and Asthma Network, the Peace Survey. Tell us a bit about it.
Sure. So I am a cannabis epidemiologist, which means that I do studies looking at how outcome studies on how people use cannabis, patterns of use, whether it makes them feel good, benefits, adverse effects, knowledge, attitudes. And so we've partnered with the Allergy and Asthma Network, the Asthma and Allergy Network, to look at people with asthma and allergies to find out how they're using cannabis. And the link is on the homepage, so please visit the homepage. Click on the link, take our survey. It's anonymous, it's confidential, and it's going to be very helpful for us to give patients with asthma and allergies and other conditions information on what might be helpful or harmful if you're using cannabis.
I think I just want to emphasize one other point is Joanna has done some innovative study which has been published on cannabis use within athletes, and we've learned quite a bit about that, and we want to now be able to learn similar concepts of what are affecting patients who have asthma and allergy and use of cannabis.
Absolutely. So is the survey only for those who have used cannabis, or can non-users also take the survey?
That's a great question. Thank you for asking. The survey is for anybody, anybody's cannabis status. So if you've never used it, if you've used it in the past, if you're using it now, that all of the above. The only criteria are that you've been diagnosed with asthma or allergies or some other conditions that we have listed on the website. And again, it's an anonymous survey. We're not collecting names or emails, but we just want this information so that we can help with education.
Right, we're going to learn about the attitudes people have towards cannabis, even if they don't use it. We want to know why people may or may not be using it, their attitudes, and if they do use it, whether they're getting benefits or any adverse effects.
Absolutely, whether they're using it for their condition that we're discussing or for some other condition. And we know that, of course, policies are rapidly changing across the United States, and now there are over a dozen states that actually where cannabis marijuana is legal. And so, again, as we see these evolving policies, we're trying to get a better understanding of how this is actually being utilized and any potential risk, harms, benefits, and side effects within the allergy asthma community as a whole. So please go to allergyasthmanetwork.org, and as Joanna explained, click on the link for our Cannabis Peace Survey. Complete that, and certainly we will be sharing all of those results with our community as we learn together.
Yeah, and so we have about 700 respondents so far.
Awesome.
And, we're very excited about that, but we still need your response.
Absolutely. Yes, we need everyone who's out there watching to definitely go on and complete the survey. It takes, what, about 10 minutes, Joanna? Is that right?
About 10 minutes, yep.
Yep. So in our last couple of minutes together, are there any closing comments or last thoughts that you would have, Dr. Bob?
It would be. Dysfunctional breathing is common. It can adversely affect your life and how you deal with things. It'll certainly affect your inability to exercise. And it is something that with work can be improved upon. And I think Joanna has given some very, very good advice on how to do that. But it's a real potential problem that needs to be dealt with.
Absolutely. Yes. Thank you. And Joanna, last words from you?
Diaphragmatic power and practice makes perfect. It's something that you have to work on. Don't get frustrated. You think about how many millions of breaths you've taken in your life, and it's not going to change overnight. So please don't be frustrated. And if you have any questions, send them to the Asthma and Allergy Network. They'll get them to me, and I will try to help out in any way I can.
Well,
and Tanya, we want to thank you for giving us this opportunity.
Yeah, absolutely. Thank you guys for joining us this evening and for teaching our community how to breathe better together. That really is the aim and the goal of everything that we do at Allergy and Asthma Network. It's been at the center and heart of our mission since 1985 to help end the needless death and suffering due to allergies, asthma, and related conditions. And we know that it's through these types of outreach and education efforts that we can truly make a difference for the 60 million Americans that are living with these conditions. So thank you again, and I hope you guys have a great rest of your evening. And I know what I'm going to be doing this evening, practicing my diaphragmatic breathing, which needs a lot of help.
Oh, thank you.
Thank you. Have a great evening. Take care.
You too.